My dad works in B2B marketing. He came by my school for career day and said he was a big ROAS man. Then he told everyone how much he loved calculating his return on ad spend. My friends still laugh at me to this day.
Not everyone gets B2B, but with LinkedIn, you'll be able to reach people who do. Get $100 credit on your next ad campaign. Go to linkedin.com/results to claim your credit. That's linkedin.com/results. Terms and conditions apply. LinkedIn, the place to be, to be.
Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach nursing concepts and share tips on how to thrive in nursing school and at the bedside. Today, we are talking about a very, very common skin condition, cellulitis. Now, before we jump into that, let's take a quick minute for our listener shout out. And I hope I'm saying your name right. This one goes out to Roshi, who says this: before taking confident calculations, I was completely lost. The overview of dimensional analysis has been a godsend for me, and now I feel confident going into my upcoming dosage calculations exam. Thank you. Well, Roshi, thank you so much for sharing your experience with confident calculations. I am absolutely thrilled that you're going into this crucial exam feeling that you're confident and you're ready. So if you're new to nursing school and you're not really sure what Roshi is talking about, you will have a dosage calculations exam very early in your first semester, and then as most schools do it, very early in all your subsequent semesters as well. And in most cases, this is a do or die exam. You have to pass, otherwise you are excused from your nursing program. You will get more than one attempt in most cases, sometimes 2, sometimes 3 attempts, but still a very high stakes exam. So you have to know how to do dosage calculations with absolute accuracy. And I teach you a method for how to do that in my program, Confident Calculations. If you're ready to learn how to do dosage calculations with total confidence and 100% accuracy, go to straightanursingstudent.com/calculate. All right, are you ready to dive into cellulitis? I know I certainly am. So here we go. Cellulitis is, as I said, a very, very common infection. It is a skin or dermal infection that occurs when bacteria enters the body through a break in the skin. This could simply be from very dry skin that has little tiny cracks in it. It is often, though, related to a wound. It could be from an ulcer. Maybe the patient has some vascular insufficiency, so they've got one of those ulcers that are really hard to heal. Maybe just a surgical incision. It could be related to fungal infections of the feet. It could simply be from a bug bite or dermatitis. So really, anything that causes impaired skin integrity can let bacteria in and can lead to cellulitis. Now, cellulitis is usually just localized to the skin, but it can spread into the bloodstream. So even though it's a very common condition, it can become very serious if left untreated. And when bacteria get into the body, they get into the bloodstream, the body can have that overwhelming inflammatory response, which is sepsis, and that is a life-threatening condition. Other complications of cellulitis include osteomyelitis, which we'll be talking about in an upcoming episode, endocarditis, which is inflammation of the inner lining of the heart and the heart valves, and that can be very, very serious. Other complications are a joint infection, thrombophlebitis can occur, and even tissue necrosis or tissue death. So the most common pathogen responsible for cellulitis is group A streptococcal bacteria. So usually group A strep. However, the incidence of a staphylococcus caused cellulitis is increasing, and that specific one is methicillin-resistant Staphylococcus aureus, or MRSA, which is highly, highly transmissible. MRSA is highly transmissible and difficult to treat. So in addition to having a skin injury, risk factors for cellulitis include having lymphedema. And it's important to note that lymphedema doesn't just occur in patients who, like we think of lymphedema, we often think of the patient who's had lymph nodes removed for cancer treatment, often breast cancer. And these individuals will have lymphedema in their arm. Well, lymphedema can also occur in individuals who have undergone coronary artery bypass graft surgery. Let's say they take that vein from the leg. Now we have lymphedema in the leg. So your patients with a prior CABG are going to be at risk for cellulitis because of the associated lymphedema. Other risk factors include immunosuppression. Any patient with a compromised immune system is going to be at risk because simply the bacteria get in through that tiny break in the skin and the body can't fight it off, and cellulitis occurs. This includes patients undergoing treatment for cancer, patients taking corticosteroids, patients with renal disease, patients with diabetes, all kinds of reasons for patients to be immunocompromised. Also at risk are those with venous insufficiency, patients with obesity, and those with chronic skin conditions like eczema, which makes perfect sense, right? So again, risk factors for cellulitis, lymphedema, immunosuppression, venous insufficiency, obesity, and chronic skin conditions. So now that you've got a little background on cellulitis, I want to go through it with you in my latte framework so that you have a systematic way to think about the most important things you need to know about this disease condition. So if you're new to the latte method, welcome. It's going to change your life, especially if you're a student. The L stands for look. How does the patient look? Basically, what are the signs and symptoms of this condition? A stands for assessment. What are we going to do to assess our patient? The first T stands for tests. The second T stands for treatments. And then E is for education. So let's dive in and we'll start with L. How does the patient with cellulitis look? So the key thing here is that they're going to have this skin inflammation. And what you will notice is that the skin is red, it's got some edema, it's probably warm, and it may even have a dimpled or orange peel texture, and it's likely painful to the touch. Now, that area of inflammation in cellulitis generally has a pretty definable border. And when the infection spreads, you may even see streaks in the skin as well as enlarged lymph nodes. So key things to know are we're going to have red, swollen, warm, possibly dimpled or orange peel skin that's painful to the touch. It will have a pretty defined border, and you could see streaking and enlarged lymph nodes as that infection spreads. Now, it's also interesting to note that cellulitis usually affects the lower legs, but it definitely can occur anywhere in the body. And note that cellulitis is generally unilateral. So let's say you've got a patient with poor circulation. Maybe they have some issues with their vasculature, right? They've got poor circulation. So they have red lower extremities, both legs equally red. That's probably not cellulitis. Cellulitis is generally unilateral, meaning it's only going to affect the extremity where the infection is present. Patients with cellulitis will often also have a fever because the body's trying to mount an immune response and generally feel unwell, which you may hear called malaise. All right, so that's basically what the signs and symptoms of cellulitis are. The next letter in the latte method is an A, and that is for assessment. What are we going to do to assess our patient with cellulitis? You definitely want to monitor vital signs. So the patient will probably have a fever. You want to keep an eye on that. And they may also have an elevated heart rate, which is tachycardia. That comes with fever, that comes with pain. definitely want to be monitoring their heart rate. And if sepsis occurs, they could have an even higher heart rate and they could have some hypotension as the body is mounting that overwhelming, overblown, out of whack immune response to the infection. And if you want to learn more about what we do to treat sepsis and why it's so important to treat it early, I'd love for you to go and listen to episode 243. All right, so other assessments for cellulitis also include assessing the patient's pain. Cellulitis is painful, and the pain with cellulitis is generally localized to that area of inflammation. If the cellulitis is on their left arm, it's going to hurt where the skin is red, not necessarily above, below, or on the underside of the arm. It's very localized to that area of inflammation. And this will become important when we learn about osteomyelitis in a subsequent episode. The patient may also find that having things touch their skin is irritating. Like, let's say they've got cellulitis on their arm and their bedding is on their arm, like their sheets. They may find that really irritating. They may find having clothing touch the area irritating. So you want to make sure you keep those things off the patient's skin. You're also assessing the skin for that warmth. Touch it with the back of your hand. Feel that warmth. You'll also note the tenderness and the swelling. And in some cases, blisters may occur. And if they are occurring, you definitely want to monitor for those. Also, really important for cellulitis, and I feel like this would be a good exam question, is to monitor the size of the affected area. A key thing that we do in the clinical setting when a patient has some kind of skin situation is we get a marker and we outline it. And that way we know right away, is this infection spreading? Makes it very, very easy to notice. So that next letter in the latte method, if you remember, is a T, and that stands for tests. Basically, we want to know what tests are utilized to evaluate this condition. And it's not because you're ordering the tests, right? That's the doctor's job, the MD, the DO, the NP, the PA's job. It's one of those people's jobs. But when you know what tests are utilized to evaluate a specific disease condition, guess what happens? You now know what to go look for in the patient's chart to monitor how they're doing, to monitor their progression or their improvement. So in general, just the basic diagnosis of cellulitis is going to be done by the physician simply by, in most cases, examining the skin, looking at their associated signs and symptoms. But there are some additional tests that may be utilized. One is a white blood cell count. And in most cases, the white blood cell count will be elevated. Now, it's important to note that in some cases, when the infection is overwhelming or maybe the patient is immunocompromised, the white blood cell count can actually be low because the body's using up the available white blood cells and they're not able to produce more. So elevated is generally what happens, but just because, like, let's say you see a patient with a lower white blood cell count, but it looks like they have cellulitis, I wouldn't want you to think, oh, well, they don't have an infection because their white blood cell count is low. No, what's probably happened is the body's using up their available white blood cells. And in sepsis, especially, the white blood cell count can be low because the immune response is totally out of whack and we use those white blood cells up. Okay, so white blood cells is one. Another is the CRP and also maybe the ESR. CRP is C-reactive protein and ESR is erythrocyte sedimentation rate. And both of these labs are elevated in inflammatory states. Now, a lactate level could also be done if we suspect your patient has sepsis, and then a wound culture. Now, this is really only done if purulent drainage is present. Like, let's say we have a wound with purulent drainage, and we want to know exactly what's causing this infection so we can highly target our antibiotics. That is a case where a wound culture may be done, or if we're looking for MRSA. However, just a general skin culture in a non-draining type of wound has not really been found to be helpful in cellulitis, so it's generally not utilized. What about an ultrasound? Why might a patient with cellulitis get an ultrasound? Well, think about what signs and symptoms they have. They have unilateral leg swelling that is red and warm to the touch and painful. Well, that could mimic a DVT. So if the physician thinks, oh, well, they're also at risk for DVT, maybe they are pretty sedentary, just got off a flight from Malaysia, whatever the risk factors may be, they could do an ultrasound to look for a deep vein thrombosis. And then X-ray, we could use diagnostic imaging to determine if that infection has spread to the bone, a condition called osteomyelitis, which again, we'll be talking about in an upcoming episode. So again, those additional tests would be white blood cell, CRP or ESR to look for inflammation, lactate if we suspect sepsis, wound culture maybe if there's some purulent drainage or we're having difficulty figuring out the antibiotic therapy, an ultrasound to rule out a deep vein thrombosis, and an X-ray to see if this infection has gone into the bone. All right, let's take a quick minute for a little bit of a break. When we come back, we'll talk about the treatments for cellulitis, key things to educate the patient about, and we'll do some pod quizzing to test your understanding. I recently threw my husband a big birthday party, and you know what? Between the decorating, the cupcakes, the food, it was a lot of work. But one part was actually pretty easy, and that was the wine. Because I'm a First Leaf member, I already had wine on hand, and I knew all of it was going to be good. And that's because First Leaf is a wine club that is completely personalized. They take into account what I actually like and hand select wines that are just for me. Plus, if I've got an event coming up, like a family dinner or a birthday party, I can opt for First Leaf's Fine Wine Upgrade to get a really special bottle that's sure to impress. Now, since it's summer, I've been enjoying the white and rosé wines from First Leaf. A couple of my favorites have been a Chenin Blanc from South Africa and a Vermentino from Italy. So bright and refreshing on a hot summer day. Plus, I love how much I can tailor my membership. I can choose 6 or 12 bottles, get the perfect blend of red, rosé, and white, and this is the best part, select a shipping window that works for me. Get wines to sip and share all summer long with First Leaf. Go to tryfirstleaf.com/nursemo to sign up, and you'll get your first 6 hand-picked bottles for just $44.95. That's tryfirstleaf.com/nursemo. tryfirstleaf.com/nursemo. Alrighty, now let's look at the next T in the latte method, which stands for treatments. How are we going to treat cellulitis? So in most cases, cellulitis can be treated at home. Not every patient who has cellulitis comes to the hospital, though severe cases with complications definitely could require hospitalization and more advanced care. In general, treatment for cellulitis includes antibiotics. That's the key thing. We've got to take care of that pathogen. In most cases, again, it's not super severe. The patient can take PO antibiotics and start feeling better within a few days. But if it's severe, let's say they've developed a complication like endocarditis or sepsis or osteomyelitis, now we're talking IV antibiotic territory. What about the pain associated with cellulitis? NSAIDs are great at reducing the pain associated with cellulitis, getting that inflammation down, helping the patient to feel better. In some cases, acetaminophen could also be added to act as, to kind of give that NSAID a synergistic effect to help treat the pain related to cellulitis. We don't generally need opioids for the pain from cellulitis. Another key thing to help with pain and inflammation is to simply elevate the affected area. Something I teach my students in clinical and here on the podcast is that as a student, you might sometimes feel a little powerless to treat a patient's pain because maybe you're not able to give meds yet. Maybe the patient's not due for any pain medication, and then you feel a little bit stuck. I mean, as a nurse at the bedside, sometimes I feel like, okay, well, they can't have any more pain medicine for another hour, but what can I do because they are having pain right now? Something simple like elevating the extremity can be very helpful. So when your patient has pain, I want you to always be thinking about these kind of complementary therapies, these non-pharmacologic therapies that you can do and are empowered to do as a nurse to help your patient's pain. We don't always have to go straight to the morphine, right? We can do other things. So elevating the affected area is one, and another is cool, clean washcloths on that skin. That skin feels warm or hot, it's got swelling, it's got pain. That cool, clean washcloth can feel really, really good for your patient. So that's two things you could do that don't require physician order, that don't require you to do anything extra complicated. You can just elevate and apply a clean, cool washcloth and help your patient with their pain. And then the next letter in the latte method is an E, and that stands for education. How are we going to educate our patient about cellulitis? Well, a key thing for them to know is that cellulitis in and of itself, not contagious. They're not going to spread it to their friend or their family member. But if they do have MRSA, that methicillin-resistant Staphylococcus aureus bacteria is pretty darn transmissible and can definitely spread. So, if your patient has an active MRSA infection, they will be on contact precautions. You are putting on gloves, you're putting on a gown every time you go into the room. You are making sure that family knows that they are going to be donning and doffing their PPE. And if the patient is at home with MRSA, you're teaching them not to share things like towels or washcloths or bedding or things like that. They're not sharing personal items and they're not having like close contact with other individuals. But in and of itself, cellulitis, if I have cellulitis in my arm, I'm not going to give it to you by shaking hands with you. All right, very, very key component of education for cellulitis is prevention of cellulitis. So to prevent this from occurring when a wound happens or a break in the skin occurs, you want to teach the patient that it's very important to keep the wound clean and the skin around the wound clean. So let's say they get a little cut on their leg. They need to make sure that they're washing their leg with soap and water every day. And also, it's generally recommended to cover that wound with a bandage. We don't want anything getting into that wound. And in some cases, an ointment may be utilized. Let's say the patient has eczema. So they've got a lot of tiny little breaks in the skin. Providing a barrier with something like Vaseline or some kind of skin ointment can help to keep bacteria from entering the body. So we definitely want to keep our skin clean, keep that wound covered either by a bandage or some kind of barrier ointment. If your patient has dry skin to the point where it's getting little tiny cracks in it, guess what? Simply moisturizing their skin regularly can help prevent cellulitis from occurring. And if they have cellulitis, they should watch for signs of worsening infection. So what would that be? That would be things like increased area of redness. Hey, I've got a great idea. Let's mark it with a marker so we can really see how big it's getting. If they have increased pain, if they develop blisters or purulent drainage, or they spike a fever, these would all be signs of worsening infection, or those red streaks or enlarged lymph nodes, all signs of worsening infection. And then what about your patient who's at high risk because of impaired circulation or diabetes? Remember all those things that you've learned about diabetes to teach your patient about their foot care? Really, really important because we don't want them to get cellulitis. So we're going to teach them to keep their feet very clean and to dry them thoroughly after bathing or showering, especially getting in between the toes. We want to keep that skin dry so it doesn't break down. But we also want to moisturize the skin. And we're not going to put moisturizer between the toes because, again, it can lead to skin breakdown. But in general, around the foot, the legs, let's keep our skin moisturized. We're going to wear clean socks every day. We're going to wear closed-toed shoes. In general, patients with diabetes should not be wearing sandals because it's easy for rocks and other small little things to get in there and cause ulcers. And of course, we want to teach our patients with impaired circulation or diabetes to inspect their feet daily. And if your patient has lymphedema, which, as you recall, is a risk factor for cellulitis, we want to make sure they know how and when to wear their compression devices, their compression sleeves. So there you have it, your basic overview of cellulitis using the straight A nursing latte method. And something I like to do at the end of some of these lessons is to check your understanding with something I call a pod quiz, where I ask a question, I pause for a little bit so that you can think about the answer, and then I tell you the answer. So basically, it's kind of like doing flashcards with your ears. And if you enjoy doing this pod quiz, then I have a whole private podcast of over 100 episodes, I believe, where all I do is pod quiz you on various subjects. So it's a great way to study for exams and for your NCLEX. So let's do a little pod quiz for cellulitis. Is cellulitis caused by bacterial infection, fungal infection, or viral infection? It is due to a bacterial infection. And what is the most common pathogen responsible for cellulitis? That was group A, streptococcal bacteria. And then I mentioned a bacteria-resistant type of bacteria. What was that called? That is methicillin-resistant Staphylococcus aureus, or MRSA. Very good. All right, name 2 complications of cellulitis. I mentioned several. See if you can remember 2 complications. Okay, one was sepsis. Another is osteomyelitis. There's also endocarditis, thrombophlebitis, joint infections, and tissue necrosis. There are probably others. These are common complications. Now let's look at risk factors. See if you can name 2 to 3 risk factors for cellulitis. Okay, the ones that I mentioned were, first off, just having any kind of skin injury. Then we have lymphedema, immunosuppression. So you might have said diabetes or renal failure or taking corticosteroids or undergoing cancer treatment. All of that would fall under immunosuppression. Venous insufficiency was another one. Obesity and chronic skin conditions like eczema. Very, very good. Now looking at the signs and symptoms, what is the skin going to appear like? Or what are the characteristics of the skin in cellulitis? So that skin is going to be red, swollen, warm, and painful to the touch. And it may also have that dimpled or orange peel texture to it. And then how are you going to easily monitor if that infection area is getting larger? Something very simple you can do is just use a marker and outline it. Now, where does cellulitis usually occur? What part of the body? Usually it's going to be on the lower legs, but you know it can occur absolutely anywhere. So the MD has ordered a white blood cell count for your patient. What do you expect that result to be if your patient has cellulitis? You would expect it to be elevated, though in some cases it could be decreased, again, if there's just a really overwhelming response, or maybe the patient had immunosuppression to begin with. White blood cell count, though, generally elevated. What are the 2 labs I mentioned that are inflammatory markers, meaning they're going to be elevated in inflammatory states? That was the CRP, or C-reactive protein, and the ESR, or erythrocyte sedimentation rate. And again, those are elevated when there's inflammation occurring. And then let's say we suspect sepsis and we're going to draw a lab. What lab did I mention would be drawn if we suspected sepsis? That was a lactate level. Very, very good. Now, what if we think, oh man, this patient just got off a plane from New Zealand and they have unilateral leg swelling and pain and redness and warmth? I wonder if they have a DVT. What quick non-invasive test might be done to rule out a DVT? That would be an ultrasound. Very good. There's labs that can be drawn for DVT as well. I'm not going to get into all of those. I do have an episode on deep vein thrombosis, which is way, way back in episode number 59, if you want to go and listen to that one. And then what if we want to see if this infection has spread all the way to the bone? What test might be ordered for that? That would be an X-ray. Excellent, excellent. Okay, what is the key treatment for cellulitis? Excellent. Antibiotics. Very good. You're doing fabulous at pod quizzing. I just wanted to tell you that real quick. All right, what about for pain? What medication can we advise the patient is going to help treat their pain and reduce that inflammation? That'll be your NSAIDs, like ibuprofen. So the patient might say, well, I have pain. Why isn't the doctor prescribing oxycodone? And you can say, well, actually, ibuprofen is going to be more effective to reduce the inflammation and the associated pain from your cellulitis. And then what are two very simple non-pharmacologic interventions that you can do or teach your patient to do to reduce edema and pain? One was elevating the affected area, and number two was applying cool, clean washcloths. So get them wet, make sure they're clean, place them on the affected area. Feels really good on that skin. So there you go. You just did a pod quiz, and I hope you absolutely crushed it and now feel like you get cellulitis. If you see a patient with cellulitis, you'll have some baseline understanding of their plan of care. And if you're a student, you can walk into your exam knowing you're going to absolutely get all your cellulitis questions correct. So if you liked the pod quiz, you should check out Study Sesh. That's the name of the program where I basically just do a ton of these pod quiz questions on all kinds of disease conditions. You can check that out at straightanursingstudent.com/study-sesh. I will also put a link to Study Sesh and Confident Calculations in the episode notes so that you can easily find them. You can also just go to the straightanursingstudent.com website and click on courses in the menu bar, and that will also take you there. So thank you so very much for spending your free time, your commute time, your walk-in time, your doing the dishes time with me today. I've loved sharing cellulitis information with you. I realize that sounds kind of weird, but I do love teaching nursing. So yeah, this is totally my jam, and I'm glad you were here with me today. So I will see you back here next week for more learning, and have a great week. See you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Do you find it hard to sleep at night? Then the Calm Cove podcast can help you sleep deeply all night long. Calm Cove has deeply relaxing meditation music and ambient sounds like ocean waves and crackling fires. All of our episodes are designed to help you relax and to fall asleep fast. Calm Cove is brought to you by the team behind Sleep Cove, the sleep podcast that consists of spoken word hypnosis, meditation, and stories. So if you want to listen to a beautiful soundscape tonight, search for Calm Cove on Apple Podcasts or Spotify and see how we're helping millions of people relax and go to sleep every night.